Well, the British Prime Minister Boris Johnson's government says it will review the rules for travellers from France at the end of next week. Meanwhile, France's Europe Minister Clément Beaune says he hopes London will reconsider the plan as soon as possible. He added that the decision is not based on science and that it's discriminatory.
It's excessive and, quite frankly, incomprehensible from a health perspective. At times in France, we had a difficult situation, and I understand our neighbours had to put restrictive measures in place. Now, British authorities have suspended quarantine requirements for all EU countries except for France. From a scientific or health front, there is no justification for this decision, and I hope it will be reviewed as soon as possible.
OK, well, let's get some more analysis and we can speak to Simon Clarke, a microbiologist at Reading University in the United Kingdom. Thank you so much for joining us again here on France 24. We just heard France's Europe Minister saying this decision has no foundation in science. Do you agree with that?
Well, it does seem odd. We're led to believe that the problem is with the beta variant, which is primarily, I think, in Réunion, not in France proper, if I can put it that way. So it does seem a bit strange. But I have to stress to you that in the UK, we never know why the government puts certain countries on certain lists. It just doesn't tell us. We don't know what the metrics are that they look at. We don't know how they weigh those metrics. So it's really, I mean, it's impossible to say with any surety, absolute surety, what their reason for doing things is.
OK, you mentioned the beta variant there, and as we know, it's not really prevalent in mainland France. It's in overseas territories of France. Why is that a factor, do you think, in this decision-making process?
Because the beta variant is said to have, we used to call the beta variant the South African variant, by the way. We're told that it has a reduced sensitivity to the immunity that's induced by the vaccines. So it's slightly vaccine resistant, if I can put it that way. And of course, governments don't want that in their country. The vaccines are a main principal way of controlling the virus.
Is there a concern as well that the beta variant could somehow change? There could be a mutation if it came into contact with another variant like the Delta variant, which is much more prevalent at the moment?
Well, two variants getting together and producing another variant is a possibility, although I believe that's quite rare with this virus. What's more likely to happen is you'll get small incremental changes, and those definitely will happen. That's nature. We'd be more interested in it if it didn't happen. So that's a possibility too, yes.
And, when you look at the numbers, just the number of daily cases, I mean, the UK and France have got similar sized populations, and both countries have reported for the last 24-hour reporting period about the same numbers, about 27,000 in both countries. Is that an indication that the situation in both places is pretty much the same at the moment, or would that be a rather naive snapshot of the situation?
I never think it's wise to take small numbers of daily figures, even weekly figures, and draw too many conclusions from that. We're getting far, far too much of that in the UK. The news is alive with ridiculous speculation and people telling us that they know what's going to happen next when they don't. What direction is France heading in? What direction is the UK heading in? How are these infections distributed amongst the population? Is there uniform geographical distribution or not? All these questions make a difference.
OK, and it looks like the vaccination drive in the United Kingdom is slowing down a bit. France administered about 400,000 second doses yesterday. In the UK, it was about 170,000. But clearly, these vaccinations are making a huge difference. Were it not for those sorts of numbers, the situation would be back under lockdown, wouldn't we?
I think we probably would, yes. The vaccines are stopping people stopping a lot of people getting the most serious disease, ending up in hospital and dying. What they don't do very well is reduce the transmission from person to person. And of course, we know that the vaccines aren't 100% effective. I'm not sure any vaccine is. So you will always be able to find, if you just allow in a very permissive way the virus to spread throughout society, you will always be able to find people who've done everything right, who've had their vaccines, who've behaved properly, but whom get infected and therefore can die. You'll also end up in a situation where lots of people are put into hospital. They're ill enough to go into hospital, but not ill enough to end up in intensive care. And that too will put pressure on the healthcare systems.
Okay, well, thank you so much for sharing that with us, Simon Clarke, microbiologist at Reading University. Thank you very much indeed.